Today I want to talk about healthcare. Healthcare tops the list of issues that are most important to voters in the upcoming election. That means the most important issue that influences their vote for who they're going to vote for president is how that president approaches the issue of healthcare. Now, that's a little bit surprising that healthcare is that important an issue because we have so good medical care and the capability of surgeons and the technology we have that is making people healthier than they've ever been in all of history. And yet at the same time, it's not surprising because so many people have health problems. You know, as wonderful and miraculous as these human bodies are, as much technology and medical know-how as we have, our bodies are still breaking down. And it's troubling to people that we need some kind of affordable health care. Well, no wonder Jesus did so much healing. He lived in an era where the only medical care was mostly herbal medicines and topical medicines. People swarmed around him, which is what the Gospels say did, and we can understand that. He was their only hope for healing in a world that didn't really know that much about medicine. So I want to talk about what the Bible says about healthcare so that we can reflect on the issue from a biblical viewpoint. You know, first of all, I say that the Bible tells us that healthcare should be affordable. There'd be many places I could go in the Bible that tell us that we're supposed to take care of the poor and we have an obligation to take care of the poor. But the most obvious reference is Matthew 25, the parable of the sheep and the goats, where Jesus says we're supposed to take care of the poor and we have a moral responsibility to look after the sick. I say that the only way to a just and moral society is to care for the poor, those who can't take care of themselves. But the poor who are sick are even in a separate category of people even more needy, and we have a moral obligation to take care of poor, sick people. The second thing I would say is that healthcare cannot be free. We've all learned from when we were children that there's no such thing as a free lunch, and now that we're adults, we understand nothing is free. But Luke chapter 10, verse 7 and 1 Timothy 5:18 both say a worker deserves his wages, implying that a worker deserves fair wages. We make the same point about management abusing factory workers, and that's why the labor unions were started, because they weren't paying a fair wage, because everyone deserves a fair wage. So I say it's as unjust to deprive a healthcare worker or a doctor of their wage, fair wage, in giving health care. So health care can't be free. Nothing is free. Third, I say the government can't pay for it, and here's my reasons. First of all, biblically speaking, it's the duty of people to take care of people. It's about community and of being a people together and taking care of each other, whether as families or as communities or even as a nation. Through the generations, we have tried to pass off more and more to the government so that we can just give money and not have to think about others or be compassionate in society. And I say it's a dereliction of duty to pass everything off to the system and not be engaged. The second reason I say is that economically it's not feasible. As we have heard from the candidates recently, the economics of providing national health care in a country the size and makeup of America is an unmanageable economic burden. And we have heard astronomical figures from political candidates recently as to what they think it would cost to have quote-unquote free national health care. Taxation is supposed to pay for services, and granted, it's often a burden, but it's not fiscally responsible to use taxation to oppress the population to that extent. And the third reason I say it can't be the government is that the government has not proved itself as being an adequate manager of a system as complex and demanding as fair and sufficient health care for the entire population. We have seen that even our business model, meaning insurance companies and hospitals, have struggled and to some extent failed at the task as well. But we have learned through history that there are tasks better left to smaller entities and private entities, that the government is incapable of overseeing this task. The failure of the Veterans Administration medical care for vets is instructive, that if they cannot be responsible with a smaller task, they should not be trusted with a larger task, and that's a biblical principle. So fulfilling our biblical mandate in a deep and complex issue like healthcare affords no easy answers, and I am not pretending to come to the table with a solution. I'm not a healthcare professional. I am not a CEO of a corporation. What I'm asking is that our system reflect biblical values, which to me I think would bring an improvement in the way we are doing things with regard to healthcare.